presenters. But before we start, I'll ask Peter to give a karakia. Peter.
Thank you, Barry. This karakia calls for a smooth passage and for us to be kind to each other. Kia hora te marino, kia papa paunamo te moana, hei huarahi mā tātou I tēnei rā. Aroa atu, aroa mai, tātou ia tātou. Haume e hui e tāki e. Thank you, Barry.
Good. Thank you, Peter. And it's my pleasure to introduce Kellie Rogers and Briar Irving from the Health Quality and Safety Commission. Kellie is the implementation lead in design and development for Generation 2040, and Briar is the data analyst in the same project. And it's great that you've both been able to go up your lunch to come along and talk to us. And you're actually going to talk about Generation 2040, introduction to the project and the dashboard. So welcome, Kellie and Briar, and over to both of you.
Kia ora. Thank you. Just give a brief introduction of who we are first. So I'm Briar. I am from the Health Quality and Safety Commission. For those of you who don't know, Health Quality and Safety Commission is a Crown organisation that basically looks at health quality, monitors how our health system is running, makes suggestions, does a lot of data work, and also working with consumers in the health system to make sure that things are running as best as they can be.
So I'll introduce myself. Kia ora koutou katoa, ko Kellie Rogers tōku ingoa. My name is Kellie. I'm from the National Hauora Coalition, and I'm working with Briar on this HQSC dashboard project. For those of you that don't know, the National Hauora Coalition is a primary healthcare organisation with a collaborative approach who deliver a wide range of innovative health and social programs that improve outcomes for whānau and benefit Aotearoa. So what we are talking about today is a project that HQSC has been working on in collaboration with the National Hauora Coalition, and it's this dashboard. So I'll go through a little bit of the background, and then Briar will run through the dashboard with you and share what we aim to do now and in the future. So we currently have a problem, and the problem is that our primary health care is not performing equitably for Māori. And we know this because our maternity is not performing equitably for Māori. So we have low rates of LMC enrolments in the first trimester. So that's low rates of enrolment with lead maternity carers. And in some DHBs, Māori first trimester LMC enrolments were 30% lower than non-Māori, non-Pacific people. There were lower maternal antenatal immunisation rates for Māori. Māori, tamariki or children are more likely to have avoidable hospitalisations with gastro, skin infections and respiratory conditions. And Pēpi, or babies of Māori women, were almost twice as likely to have a potentially avoidable death compared to babies of Pākehā mothers. So we know that Māori hapu mama, pregnant women, are less likely to find maternity care. They're less likely to engage in antenatal care. And that means that then they will miss out on early assessments, prescriptions, bloods, labs, connection to community and support services, and so on. But we do have an opportunity. We have an opportunity that presented itself in 2019, and this opportunity is to drive health services forward in line with best practice to address this inequity for Māori. So there was an underspend in primary healthcare, and that was to do with the community services card implementation and the budget not being spent. So a proposal was put to the primary healthcare primary health organisation services agreement to use that underspend as a one-off project to a health equity project to improve health outcomes for Māori babies. So the project plan was put forward, it was approved, and it was funded by the Ministry of Health. And that birthed the vision of Gen 2040. So if you can imagine, it's the year 2040. It will have been 200 years since the signing of Te Tiriti or Waitangi. We will have supported tamariki to thrive. We'll be celebrating the 21st birthdays of these rangatahi. It will be 21 years since the implementation of the project in 2019. We'll also be celebrating that we have been able to significantly reduce or eliminate the hallmarks of inequity and its determinants. And we will have been able to do this by delivering consistent, comprehensive and equitable care that started before birth in 2019 and has continued on throughout the life journey. And in order to do this, we needed to develop tools that could support and encourage equitable care in Aotearoa, New Zealand. So we started off by reviewing what was already out there in terms of early pregnancy assessment tools. And what we found was that there was lots of people in lots of places around Aotearoa, New Zealand, who had already started on this journey. So what we saw there were that we all had shared vision, shared outcomes. So Dr. John McMenamin in Whanganui had already developed an early pregnancy assessment tool that he was using locally. Dr. Bev Lawton and Francesca Story had started on the He Korowai Manaki project in the Hawke's Bay. And then we saw Christine McIntosh, who was implementing SUDI tool in Counties Manukau region. We collaborated with these subject matter experts and created what we now know as the Best Start Kōwae, so the Best Start suite. These were also informed by regional health pathways, and we were able to implement and integrate Ministry of Health guidelines as well. And then we also looked at the perinatal morbidity and mortality recommendations and integrated these into the tools as well. So here birthed the Best Start Kōwae, the Best Start suite of decision tools. So the first tool of the suite is Best Start Pregnancy, and it's an early pregnancy assessment at the confirmation of pregnancy. And it looks not only at the physical health, but also asks about mental health, assesses social and whānau well-being, and ensures that the correct labs are ordered with the correct prescriptions are written. And then continuing on from there, we have the second trimester check-in, and that's an opportunity to ensure that there has been connection to a midwife, ensuring that flu and pertussis vaccinations have been offered. And then we move on to Best Start Pēpi, which is a postnatal, so after birth baby check. And this is an enhanced well child tamariki order check. And it's an opportunity to connect back into primary healthcare and develop a relationship into the GP and nurses in their primary healthcare organisation. Simultaneously, we want to offer Best Start Mama, which is another 6-week postnatal check, which focuses not only on the physical well-being, but most importantly on mental health. As we know, this is the leading cause of maternal mortality in the first year after birth. So you're probably wondering what these tools look like. And here I've got a few snips for you that I'll talk through. So this is a snip from Best Start Pregnancy, and we're looking at the examination screen here. As you can see, there's a series of tabs that run across the top for really easy navigation through the tools. We have an integration with the practice management system. So any previous blood pressures that were recorded in the past year will be fed into the form, and vice versa. We have further information available by these I buttons. So this will guide clinicians throughout the assessment and help them ask the questions, especially if it's a nurse or a junior doctor that's using the form and perhaps isn't super familiar with the terminology. We've got a whole range of clinical guidance that is generated throughout the form. So wherever there's been recommendations made for this assessment, they'll come up in an aqua box. The form is really clever. it will take what data is input and it will generate recommendations throughout. Then we have links to regionalised health pathways so that no matter where you are in the country, you know that you're able to connect in with the correct guidance for that area. And we also have a really easy e-referral system, and that's found on our Actions tab. The Actions tab generates a kind of to-do list where any of those aqua colour boxes with that clinical decision recommendations will land and generate recommendations for healthcare professionals. So as you can see, there are a lot of data points throughout this form, and it shows us what we're, and when we review it, it shows us what we are doing, how we're doing, and how we can do better. So that was recognised, and that's how we came to collaborate with the Health Quality and Safety Commission. Our old clinical director, Dr. Rawiri McCree-Jansen, decided that something needed to be done with this data that we were capturing, and we wanted to have the opportunity to display it so that healthcare professionals could see how they were doing and how they could do better. So we joined up with HQSC, and that's where the relationship with Briar came about. So I'll hand over to Briar and let her share the screen to show you through the dashboard.
Okay, kia ora. So the dashboard takes the data that is input into the Best Start tool. Currently, this is only the Best Start pregnancy tool. The Best Start Pēpi has started being rolled out, but it's not currently in the data in the dashboard yet. But we have 3 main pages when we're looking at the dashboard. Just a heads up that this is all going to be using dummy data. Just for privacy reasons, we don't want to show you the actual data that's in the tool, but should give you a good idea of what kind of things the PHOs can see when they look at their data. So in the first page here, we have a summary of recording. So this is unique to each PHO. They will see how practices within their PHO are recording data within the tool. So they'll be able to see each of the indicators, how often it's being recorded, whether there's a difference in how Māori and non-Māori mothers' information is recorded, and whether they're doing better or worse than other PHOs around the country. They can also see a summary of practice data, so seeing how many records each practice within their PHO has, and then also the average completeness of the tool within those practices. So this is, obviously there's a lot of information within the tool, and so we're wanting to see how much of the tool is actually being completed each time a practitioner goes in to use it and record information for hapumama. You can see here that all of this information can be filtered. The filtering opportunities are by ethnicity, by age group, and by year of recording. Not a huge number of years yet, but over time that will be quite useful, I think. The next page that we go into is indicator detail. And at this level, we're looking at national rates of recording. So that is how often the specific indicator is recorded within the tool. You can choose here which indicator you're interested in. So if we wanted to look at, for example, whether they're taking supplements, we can have a look at how that looks across PHOs. We can compare ethnicities. The tool always shows Māori in comparison to whatever other ethnicity you've chosen here. So currently it's all ethnicities, but if you wanted to compare Māori and European and other, you could do that. And you can also filter by age, and by year. You'll notice that this is getting smaller as I choose more filters. This is because any group that is whose count under 5 gets suppressed, because even when we're showing this to PHOs, we don't want to give away people's personal information too readily. In the demographic tab here, you can see results across all ethnicities and then across all age groups, and this again can be filtered. So currently this is filtered by age group, and this is showing the ethnicity that you've selected. And then onto the final page, we have a bit of analysis. So this uses chi-square tests to assess the actual responses that people have given. Again, this is dummy data, so these responses don't actually mean anything, but this takes any of the indicators where we can actually get a statistically reliable analysis out of it, and gives us an idea of whether there's any difference in how Māori or non-Māori are responding. So for instance, you could see whether Māori are more or less likely to be provided information on finding a midwife if they don't already have one. Because of course, all of these questions, the analysis is filtered by whether this is actually a relevant question to them. And yeah, so this is because it relies on the data actually being statistically reliable. It doesn't show all of the indicators, but anywhere it's possible to get a straight answer out of it, it's in there. We also have tables to get a little bit more of the information for the data nerds who want to see residuals and that kind of thing. Yeah, so that is the dashboard in its current state. I see there is a question already. Is the default group always Māori, or can it be changed to something else? So the default group is always Māori. I'm assuming you're meaning like if we go into here, the comparator group. Because the project is focused around improving equity for Māori, the default group is always Māori. But of course, you can always change the comparator group here, so you can still get all of that information. In the future, we have talked about including Pacific peoples as another comparator group, but at the moment, the amount of data for Pacific peoples in the tool is very low, so it probably just wouldn't work. That it wouldn't come up very often. But definitely that is something we're keeping in mind for future development. I will. Can we receive the data for patients within our PHO from the tool to allow us to combine it with other data we hold? Yes, so if you have a look at this page, so you'll see there's a little data download here. So this gives you a download of this table. currently the tool doesn't hold individual level data, so individual level data can't be downloaded from the tool, but this aggregated data all can be, and that will include any of these as filters as well.
Just on that, if you do need to access individualized data, it can be accessed from the back end of the tool with a two-factor authentication specific to your PHO. So nobody else can access it, just you. So if you do have, if you are using Best Start within your PHO, your practice, and you do want that, all you have to do is just let me know. For the most part, we've got a majority of the PHOs signed up so that they can see this, but I'm sure there's some out there that don't have access.
Yeah, the hope is that this can be really useful for practices and PHOs. So yeah, anything that we can do within reason to help people use it more effectively is definitely something we want to do. I'll just stop share for a second so that Kelly can bring the PowerPoint back up. Awesome. Cool, so I just want to quickly go over what our current future plans are, what we're working towards at the moment. We have very recently been able to access encrypted NHIs for the data that's collected through the tool, which means that we are able to link this data to the national data sets that HQSC has access to. And so this allows us to see things like lab results and dispensing for people who are using the tool. So we can see if a person has been recommended in the tool to be prescribed aspirin, for example, have they then gone and picked that up? We can also see if a lab test has been done with that, what that result is. Can the tool access data from different PMS's patient management systems? Kelly, that's a you question, I think.
So the tool can be used on Medtech Evolution, Medtech 32, Indice, and My Practice, and it just needs to be installed. There's no costs associated with installation. It's just guiding you through, or one of the Gen 2040 team installing it for you. So if you do want to get it within your practice, then feel free to reach out to me. I realise we haven't put our contact details onto the PowerPoint, but I'll pop my details in the slide so that you can reach out, or into the into the chat box so you can reach out.
Awesome. One of the other things that we're working on at the moment is a collaboration with Lynn Sadler's team on the project Taonga Tukuiho. They're developing guidance at the moment around preterm birth, and have contacted us to collaborate on developing a preterm birth page on the dashboard that will use that guidance document to inform what's shown on there, you know, the indicators that people will see, and hopefully will be able to contribute to improvement in preterm birth outcomes. And then we're also working on further integration with the other modules in the Start Kōwae. So you've seen that there's also a 6-week Pēpi and a Best Start Mama module in the suite of tools. 6-week Pēpi is already being rolled out in practices. And so that information around things like baby's condition, progress on feeding and sleep, well-being for mum and baby, all that will hopefully soon be in the tool, in the dashboard. And then also the Best Start Mama, that is currently planned to roll out early next year. So once the data starts coming through for that, we will start to be able to input that into the dashboard. So that's things around anxiety and depression, wraparound care, so things like housing and smoking and family violence, and also physical well-being for mama. Those can start being seen within the dashboard, and we'll hopefully start to see some improvement around that. So yeah, I will open up for questions then. Yeah, any questions around the dashboard or on the project?
Thanks, Kelly and Briar. And a few questions have actually already come in, and I think they've both been, you both answered those, and Kelly's also put up her email address if anyone does have any questions. I'd like to congratulate you and your colleagues on such a great initiative. And one of the things that particularly pleases me is you've actually done all the legwork, all the hard work, and it puts the emphasis then on, so what does this mean? I see you've got that quote from Rowley there, is understanding what it all means actually is the human part. And I think that's what we're all about, and certainly in PHONZ, is what does this all mean and how can it be used to improve the health of New Zealanders? So well done. There is a question, I think, Patrick, is that right? Can LMCs use this tool? Are there linkages to WCTO?
Yes, I can answer that one. So LMCs can use the tool. They're able to access the tool from a web browser using two-factor authentication. We're working with the College of Midwives at the moment to look at how we can integrate further into practice management systems that midwives use. So Maternity Solutions, Expect, and there's a few others. And well child providers are also able to use the tool. Again, it's either via a web browser or via a PMS if they have access to Medtech Evolution, 32, My Practice, or Indice. So absolutely, and if you are a well child provider LMC, we'd love to get you linked in. The part of what we're trying to achieve is to prevent these mama and Pēpi from getting lost and falling through the cracks. So being able to have a set of data that does follow them rather than making them fit into where our data is kept is really important, so that they don't have to re-explain themselves to every single healthcare provider that they go to, that they can work on developing relationships rather than re-explaining their physical well-being and their history every single time.
Great, thanks, Kelly. Another question is, you might have already mentioned it, but could you give a quick update on referrals function in the tool?
Yes, so referrals, so the referral tool is called Tuku, and the developer calls it the referral tool for ordinary people. So it's super simplistic in the way it is set up and used. We create service providers are created within Tuku. So for example, smoke-free are able to be integrated into Best Start Pregnancy, and we can click a button and it will send a referral off to the smoke-free provider. For example, they'll receive an email saying that they've got a referral waiting for them. They log into a web browser, again, two-factor authentication to protect any personal details, and they can access that referral. So it's super simple. and also there's no cost involved with that.
It's always an advantage, no cost involved. If anybody else does have a question, and you can raise your hand, or you can even type it into the chat, and Kelly and Briar will answer it. Lots of thinking. So what's the what is your projected uptake of this? I mean, it's one thing to put it onto a website. You must have an audience that you hope and will canvas to use it. You know, how, apart from, you know, we have lots of dashboards and things these days in the health sector. What's how are you going to promote it, and you hope your end users are going to do with it?
I mean, the hope is that, you know, through communicating a lot with the PHOs and the practices that are using the tool, that we can make the dashboard useful for them. The idea being that the dashboard will show at a higher level, and also with more analysis, what is actually going on with the answers that people give. Because, you know, when you're in the practice, you're looking at a very individual level. You're seeing a person and their specific information. You're not necessarily seeing at a national level, when you're adding all those responses together, what the patterns are that come through. And so the hope is that we can provide practices and PHOs with a tool to be able to see those patterns, and therefore to improve results for people, and also to show that the work that they're doing is actually making a difference.
Yeah, okay.
What we've seen is a lot of interest from PHOs, GP clinics around wanting their data, wanting to see it, wanting it displayed in a really easy to read and access way, and this is a great solution for that. So in terms of promotion, I don't think it needs a whole lot. As long as we've got as long as we're communicating with the GPs and the PHOs to make sure that they know it's there. And so far so good. We've had some really great feedback, and they're really loving that it's so easy to read and use.
I think, and what appeals to me is that then it puts the onus for interpreting it at their own level back onto them, so they don't have to worry about how it's displayed and whatever. It's consistently and robustly displayed, and it's over to them to offer their local interpretation, which I think is where the focus needs to be. Lynette has asked a question. If time, could you walk through hepatitis B screening follow-up with this tool? Could you walk through? Have you seen that? Question?
I think there's only one part. I'm just trying to think of where it is in the tool. In Best Start Pregnancy, there's an opportunity to ensure that all antenatal bloods have been done, and hepatitis B is within that part. At the moment, we are prompting healthcare professionals to make sure that they offer that blood test and during early pregnancy. And then there's a place in the 6-week Pēpi check, and that prompts a healthcare professional to ensure that hepatitis B immunoglobulin has been given at that point. That is a part of our next step, as Briar explained, integrating lab results into the form. So if correct me if I'm wrong, Briar, but if we can connect the individual lab result with the being Hep B positive, then we can connect it to the baby's NHI and push an alert through to remind that healthcare professional that there needs to be Hep B follow-up.
Oh, thank you. So is there any other questions? Chat? No. Well, I don't think there's anybody else has a question for you. I'm sure there's lots of interest amongst the people that are here and elsewhere about the tool that you've developed. And so congratulations to you and your colleagues for it. And as there's no other, I'm sure, no other questions, once again, I'd like to thank you both for giving up your lunchtime to come along and give us the PHONZ webinar for October. So thank you, and thank you everybody for attending.
Thanks very much for having us. Really appreciate it.
And yeah, always happy to get an email with more questions if people need more information. I think Kelly's email is in there, and she can forward things to me if I'm the person that can answer.
And if there's an opportunity you want to give an update sometime, just let me know, and we're more than happy to accommodate another future one. So thank you.
Awesome. Thank you. Ka kite.
Good. Thank you, everyone.